My name's Angela Douglas. Up until most recently, I was Scientific Director for a Regional Genetics Service and the Clinical Programme Director for the North West Coast Genomic Medicine Centre. We were running the 100,000 Genome Project. I've been a consultant scientist in genetics for as long as I can remember. I've worked in the NHS for over 38 years. And most recently, I've been appointed to the Deputy Chief Scientific Officer role. So my very first recollection of why I became interested in science comes really from my mother, because she says when I was 10, I was given a microscope and a chemistry set for Christmas, both in the same year. And following that, I just wanted to be a scientist, and there was nothing that would waver me off that. Even my chemistry teacher, when I was opting to do A-level chemistry, who told my mother at one of our parents' evenings that I shouldn't bother with science because I probably would never amount to anything in science, which really made me more determined to become a scientist. Getting into genetics was more to do with a really lovely relief teacher when I was doing my biology A-level. She was only with us for 6 months, but she absolutely inspired all of us to do genetics. And so she helped me complete my UCAS form. I applied to do the very first pure genetics degree at University College London, and the rest is history. For me, it has to be the 100,000 Genome Project. That was an absolute world-leading project. And the reason that it was so inspiring for us is this was a project that was being led by the NHS rather than being led for research. And we were recruiting patients in cancer and rare disease from our patients who were coming into our clinics. So this project was going to have a real impact on our patients, and that's why it's such an exciting project. We've now completed the recruitment of 100,000 patients. When we first started the project, we were told we were going to recruit 100,000 patients. We were all absolutely in awe of that. We never actually believed that we would get 100,000 patients into the project in the 3 years. And here we are at the end of that project, and we did recruit 100,000 patients. We're getting the results back from those patients. And certainly in the North West Coast, the part of the project that I've been leading, we've now seen about 300 results back that have absolutely had an impact and changed our patients' lives. And I think that's why we wanted to get into the project in the first place. We dared to believe we could change people's lives. And here we are at the end of the project, and we really are changing our patients' lives. We are going to use the legacy of the project to start to implement the whole genome sequencing that we were piloting in the project, to now embed that into normal practice. So we're going to mainstream this into the widespread medical specialisms so that all of our clinicians will have the opportunity to use whole genome sequencing to look at the rare diseases and cancers in their patients. And we'll be able to then more accurately diagnose our patients. We'll be able to more accurately personalise their treatments and their interventions. So we're now recruiting into a mainstream NHS normal practice. So for me, the biggest barrier, I suppose, is not having an academic qualification. So when I started in healthcare science in the NHS, you didn't need to have a PhD. You know, we were trained as clinical scientists. We were HCPC registration, and then you built on your experience year on year. More recently, a PhD has become really, really important. And all through my career, I've always been really busy and very passionate about what I've been doing. But I've never really taken the time to do a PhD, because I've always thought, well, that actually is a bit selfish. That's like doing something for me, and my values are more about doing things for others. And so I never really stopped to do that. But what I've found certainly in the last 10 years is I've had to work harder and prove myself to be better so that I can actually compete with people who have PhD on their CV. Fortunately for me, I've been lucky enough in 2014, the Health Service Journal recognised me as an inspirational woman leader. So I had that accolade to put on my CV. In 2015, I was recognised by the CSO team as a Healthcare Scientist of the Year, so I'm able to put that on my CV. And then in 2016, the Cabinet Office and the Queen recognised me in her 90th birthday honours list as a member of the Order of the British Empire. So I think all of those probably do trump having a PhD. I suppose what I'm trying to say is you don't have to have a PhD to succeed in science. You don't have to have a PhD to succeed in healthcare science. I know that what we do on a day-to-day basis in our lab really does have a difference, makes a difference to our patients, but not only to the patients, but their whole families. Because when we diagnose rare diseases that are inherited through families, we really do have an impact on that whole family. What we give to that family is reproductive choices. Some of our families have been through what we call a rare disease odyssey, where for many, many years they haven't had a diagnosis. And sometimes, even if we can't do anything to help them, even if there's no intervention or treatment, just having that information of why is so valuable to our families. And I think that's what's important to me. It's the really rewarding thing is knowing that we're making a really big difference to our patients. Have courage. I think it took me a long time to realise that you didn't have to be perfect, that good is good enough, and just to have courage and to go for the things that your heart really tells you that you should be doing. So I'm really lucky. In my organisation we have lots of really passionate scientists, and they love to get out and about and really fly the flag for genetics. So we've got some sessions lined up at some of the local schools, at some of the local academies and colleges, but we're also going to have a stand down in our foyer area where we are going to be extracting DNA from various vegetables, and so that people can sort of see what it looks like, you know, see the whole process. We've also got lots of posters that we're able to put up. We've got microscopes that people can look down. We've got a whole wrath of things that will be going on in our foyer area, not just for our patients and visitors who are coming into the organisation, but also for the people who are working in the organisation. And we've already started to advertise it in our staff newsletter.